Assalamu alaikum. My name is Visha Khalid from class final year morning, and my roll number is BP1450212. The topic of my presentation today is Norethesterone. It is also known as Norethesterone and sold under many brand names, and it is a progestin medication used in birth control pills, menopausal hormone therapy, and for the treatment of gynecological disorders. Norethesterone tablets has many uses. You can take norethesterone tablets to treat or manage heavy periods, painful periods, irregular periods, or periods that are more frequent than normal, premenstrual tension, endometriosis, and breast cancer, etc. The medication is available in both low dose and high dose formulations, and both alone and in combination with an estrogen. It is used by mouth or as norethesterone enanthate by injection into muscle. The side effects of associated with the norethesterone include menstrual irregularities, headache, nausea, breast tenderness, mood changes, acne, increased hair growth. It has weak androgenic and estrogenic activity, mostly at high dosages, and no other important hormonal activity. Now we see the contraindications. High dose like 10 mg per day, norethesterone has been associated with hepatic veno-occlusive disease. And because of this adverse effect, norethesterone should not be given to patients undergoing allogenic bone marrow transplantation, as it has been associated with substantially lower 1-year survival post-transplantation. At contraceptive and hormone replacement dosages, norethesterone has essentially progesterogenic side effects only. In most clinical studies of norethesterone for contraception or menopausal hormone therapy, the drug has been combined with an estrogen, and for this reason, it is difficult to determine which of the side effects were caused by norethesterone and which of them were caused by estrogen in such research. Now we see the interactions. 5-alpha reductase plays an important role in the metabolism of norethesterone, and 5-alpha reductase inhibitors such as finasteride and dutasteride can inhibit its metabolism. Norethesterone is partially metabolized via hydroxylation by cytochrome 3A4, and inhibitors and inducers of cytochrome 3A4 can significantly alter circulating levels of norethesterone. For instance, the cytochrome 3A4 inducers rifampicin and bosentan have been found to decrease norethesterone exposure by 42% and 23% respectively. Alternative treatments for this, we have one small study has suggested 10 mg medroxyprogesterone acetate TDS is as effective as norethesterone without the associated risks. Now we see the formulations and brand names of norethesterone and esters. Norethesterone dose is low, like 0.35 mg, and brand names are multiple. Uses are progesterone only, oral contraceptive. Now, number second, we have norethesterone or norethesterone acetate. The dose is high, like 5 mg and 10 mg, and uses are gynecological disorders and other uses. Norethesterone enanthate dose injection and like 200 mg, and the uses are progestogen only injectable contraceptive. Norethesterone or norethesterone acetate with ethyl estradiol dose is low, 0.4 mg, 0.5 mg, 0.75 mg, 1 mg, 1.5 mg, and uses are combined oral contraceptive. Norethesterone with mestranol dose is low, like 1 mg or 2 mg, and uses are combined oral contraceptive. Medications known to interact with norethesterone. We have some examples here. Norethesterone with the butalbital, like butalbital may decrease the effectiveness of norethesterone. If you are using low-dose contraceptive, there is an increased risk of breakthrough bleeding and unintended pregnancy during combined therapy with butalbital. Norethesterone abemaciclib topical. Using abemaciclib topical together with norethesterone should be avoided if possible. Combining these medications may increase the blood levels and effects of norethesterone. Norethesterone isotretinoin, using isotretinoin and norethesterone is not recommended at all. Isotretinoin can cause severe life-threatening birth defects if the mother takes the medication during pregnancy. Even one dose of isotretinoin can cause major birth defects of the baby's ear, face, skull, heart, and brain. Norethesterone aminophylline. Norethesterone may increase the blood levels and effects of aminophylline. You may need a dose adjustment or more frequent monitoring by your doctor to safely use both medications. Acute and short-term toxicity, we see acute toxicity following norethesterone overdose is unlikely in humans. Nausea and vomiting may occasionally occur after ingestion of high doses. Withdrawal bleeding may occur in females. Norethesterone has been categorized as a moderately toxic substance with a probable oral lethal dose ranging from 0.5 to 5 grams. Now we have a case study here in which the subject is Miss Jasmine is a 32-year-old full-time student currently completing her PhD. She leads a busy lifestyle with an active social life. She presents to your pharmacy requesting some advice in regards to her period pain. You notice she has some ibuprofen to purchase. She tells you she is concerned as she has been experiencing pain associated with her recent periods. She has felt some pain between the periods too and has noticed some spotting. Before this recent onset of pain, her periods were pain-free. Now we have an object. Dysmenorrhea is painful cramping, usually in the lower abdomen, occurring shortly before or during menstruation or both. Miss White explained earlier that until recently she had pain-free periods and has been experiencing pain between her periods as well as some intermenstrual bleeding. For this reason, you advise Miss White to make an appointment to see her doctor. You suspect there may be secondary cause to her dysmenorrhea. Other gynecological symptoms that may be associated with secondary causes of dysmenorrhea include dyspareunia, vaginal discharge, menorrhagia, intermenstrual bleeding, and postcoital bleeding. Some non-gynecological symptoms that may suggest a secondary cause may be rectal pain and bleeding, which may be associated with endometriosis. A secondary cause is more likely if symptoms start after several years of painless periods. The assessment, if we talk about our assessment, Miss White returns to your pharmacy with a prescription for naproxen and norethesterone. She has been diagnosed with endometriosis. She is concerned about her long-term fertility and is interested to know why the doctor prescribed norethesterone. Endometriosis is the growth of endometrial-like tissue outside the uterus. It mainly affects women of reproductive age, and although its exact cause is unknown, it is an estrogen-dependent condition and is associated with menstruation. It is associated with symptoms such as pelvic pain, painful periods, as well as tiredness, and may have a significant physical, sexual, psychological, and social impact. Now we talk about our plan. The aim of treatment for endometriosis is to reduce the severity of symptoms, improve the quality of life, and to improve fertility if this is affected. Management options include drug treatment and surgery. Most drug treatments for endometriosis work by suppressing ovarian function and are contraceptive. Surgical treatments aim to remove or destroy endometriotic lesions. The choice of treatment depends on the woman's preferences and priorities in terms of pain management and fertility. A short trial of paracetamol or an NSAID alone or in combination should be considered for first-line management of endometriosis-related pain. If pain relief is inadequate, consider other forms of pain management and referral for further assessment. Hormonal treatment with the combined oral contraceptive or progestogen should be offered to women with suspected, confirmed, or recurrent endometriosis. Ms. White should be informed that hormonal treatment for endometriosis can reduce pain and has no permanent negative effect on subsequent fertility. Norethesterone is a progesterone. It is a potent inhibitor of ovulation and has weak oestrogenic and androgenic properties. For endometriosis, treatment should start on day 5 of the menstrual cycle, taking 10 to 15 mg daily for 4 to 6 months or longer. The dose may be increased if spotting occurs and reduced once bleeding has stopped. You counsel Ms. White on how to take norethesterone and some of the side effects like headache, nausea, vomiting, and dizziness. You tell Ms. White if she experiences any changes to her vision, symptoms of thrombosis, onset or aggravation of migraine, or the development of a new kind of headache, she should stop treatment and seek immediate medical advice. Thank you.